Just moments ago, we got new information about the cases here in Kern. Let's give you a little bit of a look. And this is just one of the new information, bits of information that we've received from Public Health. This is a look at the race and ethnicity breakdown of cases in Kern County. And as you can see, more than 65% of the cases are Hispanic. 666 cases have been confirmed in Kern County who are Hispanic. And you can see again the breakdown here of cases. This is just one bit of information. The other bit of information that we've received is breaking it down by zip code. For example, the area known as Bakersfield East previously has been broken down by several zip codes. For example, in the 93307 zip code, there are 169 cases that have been confirmed. 95 people in that zip code have recovered. Let's go to the zip code 93306, where there are 97 total cases. 53 people have recovered. And in the 93308, 48 cases total. 31 people have recovered. Michele Corson with Kern County Public Health is up and giving us an update on the new information just released. Let's take a listen in.
Our Director of Communications for the county, who will conclude, and then we will open it up for Q&A to our media as we always do. In Kern County, as of today, we have 11 new confirmed cases of COVID-19. And we want to thank you, Kern County, because you continue to impress us with how you have adhered to the governor's order to stay at home, and if you must leave for essential services, practicing social distancing. Together, we really are making a difference in our community, and we really appreciate you. I'd like to provide an update on the Kingston nursing home situation. Although skilled nursing facilities are regulated by the California Department of Public Health, the department has met with local skilled nursing facilities multiple times in an effort to help prepare them for the impacts of COVID-19 and to assist training on things like proper PPE. The state website does not accurately reflect the number of positive cases at Kingston currently. So our department asked the state for current numbers. According to the California Department of Public Health, as of April the 30th, there are 16 residents and 25 staff with COVID-19 at the Kingston nursing facility. Given the number of positive cases within such a vulnerable population, we have been in routine communication with them. Regulated by the licensing and certification program of the California Department of Public Health, the state has been on site at the Kingston facility since early last week. And we are working with the facility to address infection control procedures. The facility is required to provide and maintain adequate staffing levels, which is regulated by the California Department of Public Health. On May 1st, the Kingston facility did request help with staffing shortages. On Saturday night, a team of 35 healthcare professionals from throughout the state were deployed to assist with staffing of the Kingston facility. This team will remain in place until Kingston can reliably provide adequate staffing. On Saturday, the state issued Kingston a notification to all the residents' families on the current situation. Kern County Public Health will continue to assist the state and Kingston during this difficult time. As discussed 2 weeks ago, the members of the board recently asked County Council and Public Health to explore an option that would allow for the release of more detailed residents' geographic information about our residents that have tested positive for COVID-19, while still not violating individuals' rights. As you are aware, we have been following the California Department of Public Health Services data de-identification guidance document that dictates what information can be released while still protecting the individual identity of those impacted. However, the document indicates that an independent statistical analysis can be conducted by an expert to explore additional local methods of release. County Council has obtained outside legal assistance from a HIPAA law firm and has contracted with a HIPAA statistician. On Friday, the statistician provided guidance that would allow the release of additional demographic data. So we are very pleased today to be able to provide you with some more information, and I'd like to invite Kim Hernandez, our senior epidemiologist, up, who is going to walk you through this new information. Thanks.
Thank you, Michelle, and good morning, everyone. As you know, our dashboard is available in both English and Spanish, so we'll start there. The first chart you will see is the same as before. It shows the last 2 weeks of cases in Kern County by specimen collection date. Remember that specimen collection date is the day the patient is assessed by a healthcare provider and determined to need testing. This is not necessarily the date where the test comes back positive or the date when it is reported to the health department. But this is the earliest known date that we can objectively quantify as a patient having COVID-19. All of the data on the dashboard is preliminary, but in particular, the shaded area on the right-hand side is very likely to change as more test results are received from specimens collected a day or two ago. You'll notice that none of the 11 cases Michelle mentioned today show up on May 4th. Because those specimens were collected prior to today. None of the specimens collected today have had enough time to be processed and reported out or investigated by us at the health department. But tomorrow, you will likely see more cases added to the dashboard that have a specimen collection date of May 3rd or May 4th. Just like before, you can click on the tabs below to see the full timeline of COVID-19 in Kern County. You can still see the case status on any given date, as well as the number of tests. Below the main chart, you will see the same indicators we had previously reported. The total number of resident cases, the number of residents who have recovered and have been released from isolation, the number of deaths among Kern County residents, and the number of non-resident cases in Kern County. Next to that, you will still see the number of cases by age group. These items have not changed. Below that, however, you will see two new elements that have been added, the cases by race and ethnicity, as well as the cases by sex. You'll notice in the cases by race and ethnicity that 8% of the cases have an unknown race or ethnicity. Race and ethnicity are obtained from either the healthcare provider or from the patient directly. These elements are not always reported to a laboratory or a healthcare provider, and so they cannot always report them to us. In some cases, even as public health staff interview and follow up with these cases, the patients decline to disclose their race or ethnicity, which they have a right to do so. This is different than age and sex, which is almost always known by a healthcare provider in the process of providing care. And age and sex is not typically something that people decline to disclose. Lastly, on our dashboard, you will see a new map. This map is now divided by zip code, and you can still see the major roadways in the background. However, now you can also zoom in for more detail. This is helpful so that if you are not sure what zip code a specific location is in, you can move through the map until you find your area of interest. I'm sure you will also all be very pleased to know that you can now click on a zip code and it will give you a pop-up. Sorry, it is still loading. That probably means there's a lot of people looking at the map right now. We're going to give it a second to catch up. But so we can move on. What you can do is you can click on a zip code, and it will give you a little pop-up. And what will happen in that pop-up is that it will tell you the population of that zip code, the number of COVID-19 positive cases that have been identified as residing in that zip code, as well as the number of cases that have recovered. Remember that this is based on the location where a case resides and is not necessarily where the case was exposed to the virus. We hope this dashboard continues to be helpful to you and everyone in our community. We continue to encourage all of our residents to follow the recommendations of the CDC and the California Department of Public Health. Wash your hands and keep your distance. Stay safe. Let's all take care of ourselves and take care of each other. Thank you.
Good morning, Megan Pearson, Chief Communications Officer with Kern County. This morning I'm going to address a couple of items about Kern County as we prepare for our future and moving into this new normal. So as we mentioned in our briefing on Thursday, Kern County is preparing to get back to work. We heard the governor recently say he believes that reopening or a modification of the stay-at-home order is days away, not weeks. While we don't have any insight into exactly which elements might change or the timeline specifically, we know that we want to be in a position to react quickly. So as you heard this weekend, the local public health officer order was rescinded. Here's what wasn't rescinded: the governor's stay-at-home order and the county's proclamation of a local emergency. I know these things can be confusing, so I'm going to walk through them very briefly. So first, on March 16th, the county proclaimed a local emergency. This is essentially a mechanism that allows the county to seek reimbursement for our expenses associated with a given disaster. You may recall that we did this during the Ridgecrest earthquake. We've also done it during situations like the Erskine fire. Essentially, it allows the county to seek and access state and federal funding to help share the costs that counties are often burdened with when responding to any major disaster. Next, on March 19th, the governor ordered all Californians to avoid gatherings, to skip non-essential trips out, and the closure of all non-essential businesses. That order, the stay-at-home order, is still in place today, and any non-essential businesses that are operating do so in violation of the governor's order. On March 30th, the local public health emergency was proclaimed, and on March 31st, the Kern County Board of Supervisors ratified the local health emergency. The point of this proclamation was to give our public health department access to resources available during the public health emergency, similar to the way the local emergency works. On April 2nd, the Kern County Health Officer issued a health officer order that reinforced the governor's stay-at-home order and provided the county some resources for non-essential businesses who continue to violate the governor's stay-at-home order despite multiple educational attempts by our public health department. Since April 2nd, our residents and businesses have worked very hard to adhere to the governor's stay-at-home order, and we're really proud of how well they complied. Out of the nearly 2,000 complaints that were received, only 2 were cited by local law enforcement for refusing to close after repeated attempts by health inspectors and local law enforcement. That's 0.1% of business not complying. So Kern County business operators did an incredible job. As you can see, keeping track of these orders can be rather confusing, and the news over the weekend caused a bit more confusion. So let me be very clear. While our hope is that the governor's stay-at-home order is modified very soon, it is still in place today, and it should be followed. Our goal with rescinding the local health officer order is to start clearing the way of any red tape that would potentially slow us down in the future. The county will continue to provide education and awareness of the governor's order, just as they have been. They'll go out to the businesses who become non-compliant, and it's our hope that our education will encourage businesses to comply, just like they have been this entire time. It's our understanding that law enforcement is able to take action against businesses who continue to not comply following our attempts. The governor, the attorney general, and law enforcement are all possibilities. So added to that element is the formation that we spoke about last week about the ad hoc committee voted on by the Board of Supervisors on April 21st. This committee is working with industry sectors to provide recommendations and safety concerns within each industry that can be shared as we move forward and comply with any modified orders from the governor. These meetings are happening right now, and we'd like to thank the business leaders and business owners who are participating in those conversations and sharing their feedback and perspective. This ad hoc committee will also provide feedback when the modified orders are received to help Kern County comply with those modifications. This is all a part of our plan to get Kern County back to work. The next piece of our plan is to get our residents and our businesses reopened, is to continue to ensure that everyone has access to testing. You may remember that last week we announced that 3 testing sites will be coming online, and those open tomorrow morning. So you have the location on Mount Vernon, you have the location at the fairgrounds, and you have the location in Mojave. We are extremely excited to announce that the state has allocated a 4th testing site in Kern County. It'll be located in Oildale at the north of the river Veterans Hall, and that will go live on Wednesday. We have plans for more, and we'll be able to share more in the coming days. Just recognize that access to free testing is critical in our plan and the governor's roadmap to reopening. The sooner people are tested, the sooner they're cleared, and the sooner they can return to work. Kern County is working very hard to prepare for this safe and responsible opening of our economy. We're clearing away any obstacles that could cause a delay in implementing change to our governor's stay-at-home order. We're meeting with all of our industry sectors to ensure we understand their needs and their concerns. We're ramping up our testing capabilities with new sites coming on quickly. I would encourage all of you to watch the governor's regular updates. He streams them on Facebook and Twitter, and you can find him at CA Governor at noon on Facebook and Twitter. We also want to remind you that if you want to watch, you can watch the Kern County Board of Supervisors meeting at Kern County Television, their YouTube channel. So if you have questions about what the board's doing, that is also available to you. So now, with the end of that, we are ready for questions. So if our media will press *6 to unmute yourselves, we'll bring up the necessary or appropriate individual to respond to your question. And I believe there is a proposed order that Public Health sent out this morning. So if you'll follow the order and start with your first question.
Yeah, absolutely. Hi, this is Bion number 23. This question is for Michele. So I just wanted to kind of touch back on what Pearson said, that there was confusion when their information came out about the rescinding of the emergency order. That confusion was apparent in our newsroom with hundreds of businesses calling in, trying to figure out what the implications of those are. And we reached out to Public Health quite a bit to try to get some more clarity on that. Was Public Health, are you guys clarifying some of that information now because you guys were also trying to understand the implications, or what was the reason for that?
Well, let me first clarify, we did not rescind the local emergency declaration. We rescinded the local health officer order. And I think it's pretty clear by what Megan just reported out what that means and what that doesn't mean. Everything remains the same. We still continue to adhere to the governor's orders. However, we are now in a position where we are more nimble and we can respond quickly because the governor stated we are days, not weeks, from starting to receive some of these potential modifications for our businesses. So we are very excited that as a county, we are ready and we are eager to hear whatever those next steps are going to be. Next question.
Hi, Michele. Can you hear me?
Yes.
Hi, this is Elizabeth from South Kern School. Just going off of that last question I was asked, when that local order was rescinded, what does that change for people in this community, not just business owners, but how does that rescinding of that local order change for everyone in this community, I guess?
So everything remains the same. This, again, was very strictly so that we could respond when the governor takes action, and he had indicated that would be days, not weeks. The stay-at-home order remains. We encourage everyone to continue doing the great work you've been doing. Stay at home, only leave for essential services, practice social distancing. These are very important things for us to continue to flatten the curve and make a difference in our community. So our residents need to stay the course. We will be providing direction when we receive direction from the governor. And as Megan had indicated, we have an ad hoc committee that will be working and refining and establishing best practices as we receive guidance on how to slowly begin and safely reopening our business community. Next question.
Thank you.
Sure.
Hi, Michele.
Hi, good morning, Michele.
Sorry. I'm sorry. I was just going to ask, do you have any idea what the Business Advisory Council's recommendations will look like in terms of things like seating arrangements and other specific safety measures?
We do not, this is Megan, sorry. So we do not know what the specific recommendations will be. That is dependent on what the governor says is his proposed modifications. So once we receive those modifications, the industry sectors can weigh in on how that impacts their business and what it looks like to actually deploy those modifications, and they can provide feedback. So until we receive those, we don't know what the specific recommendations will be.
Okay, thank you.
Next question.
Hi, good morning, Michele. This is Karen Wall from KGT 17 News. We've heard reports of some restaurants who are planning to open up their dining rooms as soon as today. So, I understand you say everything is going to stay the same. So how will public health enforce non-essential businesses from opening up? Are you worried that sort of this rescinding of the order may be more symbolic and misleading?
So Karen, this is Megan. As I mentioned in our comments earlier, you are correct. The governor's order, his stay-at-home order, remains the same. And that means that businesses that choose to open up who are in the non-essential category do so against the governor's stay-at-home order. And it is still possible through the governor, through the attorney general, and through law enforcement to ask and coach those businesses and push them to compliance. So that is still the case today. If those businesses choose to operate, they do so in violation of the governor's stay-at-home order.
Thank you. And just a quick follow-up. Are you able to share what other business that was cited besides the gym?
No.
Okay, thank you very much.
Uh-huh. Next question.
Okay, Michele. This is Tony Leach of KNCR. And I'm just curious, is there anything that we can say now that's closer to, and I know we're waiting to see what the governor has to say later today as well, but are we any closer to seeing a day when businesses will resume, people can go back to work, and the services that many people require and need will be once again open and available?
Hi, Tony. This is Megan. Thanks for the question. So we don't have a date. Much like you, we are watching the governor's his conversations, and we're hearing just like you are, and we're waiting for that information. As soon as we receive it, we'll be in a place to start responding and providing that direction. We hear from the same press conference that you guys watched that he expects it to be days away. So we are eagerly awaiting that day.
Okay, thank you.
Yes, I would love to be able to tell you that we have some inside information, but we do not.
Okay, I was hoping that with the latest thing where the health officers here have had a small change, if that maybe led to someone thinking that when he says weeks instead of days, or I'm sorry, days instead of weeks, that maybe we could say that by the end of this week or by the end of next week, we can look
not in a position to say that today. We hope we'll have more information in the future. We hope that that modified order comes down very quickly, but currently the rescinding that order was truly to make sure that we are ready and we can start running immediately.
Okay, thank you.
Mm-hmm. Next question.
I have a question. This is Elizabeth again from South Kern School.
This is the Bakersfield, California, and I haven't been able to ask my question yet. I'm sorry. I was waiting for the other station to go.
No, that's okay. Go ahead.
Okay, if I go ahead?
Yes,
Okay,
please.
thank you. Okay, I just wanted to make a really quick recommendation before I ask the question. One is, could you possibly add a list to the website showing the zip codes and the number of cases? I know you have the map, but it doesn't appear to be working right now. And I think that it could just be like really, an easy thing to do to just add an actual like list of the zip codes and the number of cases that they have and the other relevant information. And then I also was hoping that since there's some things touched on today, we could get the opportunity to ask more than one or two questions. So with that, I'll just go ahead and ask my question, which is, do we know, are there, as far as the Kingston skilled nursing facilities, are there any other nursing homes that have a situation going on like that, where the county has had to provide additional staff, the state or the county has had to step in? Given that that website is not reflecting accurate numbers, can you tell us if this is happening at other local skilled nursing facilities or assisted living facilities?
So let me address your first comment, and we recognize that a lot of people are struggling to access the map right now. I've been told we've got more than 800 people trying to look at it, so it is running a little bit slower than normal. Hopefully that traffic will die down. There is a location on the map on the tools section that you can click on it, and it will show you basically a tabular view of all of the zip codes. So that you will be able to see all of the zip codes at once. So unfortunately, with the amount of traffic on the web page right now, it wasn't easily accessible to us even to demo for you live, but it is on there. It is very similar to the complaint map that we've had up, and so you can actually look at all of the zip codes at once. In response to your In response to your second question regarding other skilled nursing facilities, we are in communication with the California Department of Public Health, their certification and licensing program, as well as their healthcare associated infections program, and working with them to know what is going on in the skilled nursing facilities in our community. And so we continue to talk with them daily about the different facilities, as well as we have staff on the ground visiting these locations and in communication with these locations every day to ensure that we have the most accurate information. As you mentioned, it is not always reflected timely on the CDPH website, so we want to make sure that we do indeed have it here with us.
Okay, thank you.
This is Ralph Bailey with Kern Radio.
Go ahead, Ralph.
Hello. Hi. First, please don't take this away as a question. It's just an observation, and I could be wrong, but I did not see 93301 on your zip code map. I could be wrong, but that's just an observation, not my question. Here's my question. What has changed since I asked about the type of information that you're now providing? Did we learn something that we didn't know then? And I asked you then, were the other counties that were providing ethnicity and further information, were they breaking the law? Are we now breaking the law? What did we learn that now allows us to provide this information? And are we the only county whose public health director is not a physician? And is that why Mr. Constantine doesn't attend these press briefings, because he doesn't have the medical knowledge to answer 6 or 7 questions?
Hi, Ralph. This is Michele. And let me start with your first question. I explained it, I thought, pretty extensively in my opening remarks today. What led us to the point today to be able to release more information at the geographic level. Through the Board of Supervisors, we were able to hire a statistician. There was a a long process that we have gone through to do this within the framework of the guidelines we have been provided from the beginning from the California Department of Public Health. So I have been keeping the community up to date in the progress as we've been moving forward, secured these statisticians, and then have worked with them to get this information down to a level now where you can see the zip code levels. So we're very happy.
What about the ethnic?
Yes.
What about the ethnic information?
We have that now as well. We have the ethnicity.
I know. What has changed? Why now? Why not 2 weeks ago when I first asked about it?
Because we had to work through the statistician and get the approvals done through county council. And so we've been working through all of that to get to a point where we could do this legally and within the guidelines that we have been following from the beginning.
So we've learned something now we didn't know then.
Well, we were able to bring on a statistician that was a phrasing that allowed us to go outside of these current existing guidelines. We had the ability to consult with a statistician, and that's what our Board of Supervisors and County Council chose to do.
And that's allowed us to catch up with the other counties. And are we the only county whose the director is not a physician?
Well, I can't answer that question. We do have a health officer. It's Dr. Christopher Lyon, and of course Matt Constantine, our director. So that is the model here in Kern County.
Why don't either of them attend these briefings?
Director Constantine has in the past, and you will certainly see him again. He regularly speaks in front of our Board of Supervisors that is televised, and he is quite busy running a Department Emergency Operations Center currently. It is extensive, the work that our department is doing, everything from our call center to our inspectors that have been out in the field, working with all of our community partners, providing guidelines. We work 7 days a week. Our director is busy directing all of those efforts.
I understand that, but is it unreasonable to ask that the head of the health department answer 6 or 7 questions twice a week in the middle of a global pandemic?
That's what you have me for, Ralph. I'm the public relations officer. You have Megan Pearson here and our lead epidemiologist. And you will see Matt Constantine at the times that he decides to come out. So let's move on to the next question.
Hi, Michelle. This is Elizabeth again from South Central. Sorry for cutting you off, Stacey. I wasn't sure if anyone was going to jump in. My question is, with the opening of these 4 new testing sites this week, do you expect to see a major spike in the number of cases? And if so, is that going to postpone the local economy from opening?
That's a good question, and that may be a mashup of those of us who can answer it. So I would think that we are going through the first 3 sites. We will add an average of 400 new tests a day. So yes, you are going to see more results. I'm not going to guess as to whether or not that's going to be a spike in positive cases, but you will see more results loaded on your dashboard every day. And I'm sorry, what was the second half of that question?
If there is a spike in cases now that we're ramping up testing, is that going to postpone the reopening of our local economy?
So the reopening of the local economy will be based on the governor's orders and our ability to comply with that. So because we don't know what that modification could possibly be, it's a little hard to answer that question now. So when we have the modification or the updated orders, then we can assess how that impacts Kern County and what our current situation is.
Okay, thank you.
Thank you. We have time for one more question.
Hi, this is Karen Hua from KGT 17 News. I think a few of us here, if I'm not just speaking for myself, the rescinding of the order sort of came out of left field on Saturday evening. Was there any political pressure either from the Board of Supervisors or local senators to rescind this order? Is Matt Constantine 100% in agreement with this order using science to back this?
So again, Karen, the rescinding of this order is truly to make sure that the county is in a position to start running quickly as soon as those modifications are delivered from the governor. This isn't about political pressure. This is about our local businesses wanting to get back to work. It's about getting our employees and our local residents back to their employers and their jobs, and finding our way cautiously and safely through a new normal. So it's our way of saying, let's get the red tape. Let's not add another layer that will slow us down. Let's make sure it's cleaned up and we're ready to go. So as soon as those modifications come down, we can take a look at them and we're already in a position to respond.
Yeah, and while we're on that,
Sorry, that was our last question. So we want to thank you all for being here today, and we will see you all on Thursday. Thank you.
were the supervisors aware of this decision?
And county public health officials or county officials wrapping that news conference up, although there were still questions that were being asked. This is the latest on the coronavirus crisis here in Kern County. Again, only 11 new cases were reported or confirmed here in Kern, but the new information that we've received is on the dashboard, which shows a more detailed representation of where coronavirus is affecting communities in Kern County. Now, what we're trying to do right now is look at the zip codes. Unfortunately, Public Health said because there are so many people on their website right now, it has slowed things down a little bit. We continue to try to load this data, but it is not coming through at this time. As you can imagine, this is the first time that we've received this information, and so a lot of people are trying to get a better understanding of how this is impacting certain communities within Kern County. Kern is a very big county, and with nearly, with about 900,000 people, so you can imagine how, as spread out as people are, this is going to affect more communities than others. And so, again, a lot of people trying to access this information at this time. So we don't have exact numbers for you right now. Public Health was trying to get those numbers up, but they were not successful. One other thing that we've looked at, though, is they have broken down the cases by race and ethnicity. And we know that 66% of cases have been confirmed in the, or 66% of the total cases are Hispanic. And let's see here, the other breakdown, again, this is a dashboard that continues to freeze up here because so many people are on it right now. So again, we're looking through these numbers right now. We're trying to process it, trying to get write these down so we can better map it out for you. And we will have more coming up today on 17 News at noon, as well as 17 News at 5 later this evening. For now, I'm Alex Fisher in the 17 News Center. We'll see you back here today at noon.